10 warning signs. Your blood sugar may be too high. After 50. Many people think this is just aging. They think it's stress. They think it's the natural result of a long life, a busy mind, and a body that has been working hard for over 5 decades. They wake up tired, they feel thirsty all the time. They get up at night to use the bathroom more often than they used to, and they tell themselves it's just part of getting older. But sometimes, these small changes are not aging at all. Sometimes they are the first quiet messages your body is sending you, trying to tell you that something deeper may be going on under the surface. After the age of 50, your body begins to handle sugar in a very different way. The pancreas does not respond as quickly as it once did. The cells become less sensitive to insulin. Stress, weight gain, certain medications, hormonal changes, and even years of small dietary habits can all add up. And the most dangerous part is that high blood sugar usually does not arrive with loud, obvious symptoms. It arrives in whispers. It arrives in tiredness after lunch. It arrives in cuts that take longer to heal. It arrives in vision that becomes a little blurry by the end of the day. It arrives in a hunger that does not make sense, in a thirst that water never seems to satisfy, in tingling in the feet that comes and goes, and in a sleepiness that hits you like a wave the moment you finish a meal. In this video, we are going to walk through 10 warning signs that your blood sugar may be too high after the age of 50. We will look at why these signs happen, how they show up in everyday life, why so many people brush them off, and when it may be time to sit down and talk to a healthcare professional. These are signs you should never ignore, because catching elevated blood sugar early can make an enormous difference in how the rest of your life feels. Stay with me all the way to the end, because the last warning sign on this list is one of the easiest to dismiss. Most people laugh it off or blame it on something else entirely, but it can reveal a great deal about what is happening inside your body when sugar levels are creeping up quietly over time. Before we begin, I want to be clear about something. Many of these symptoms can have several causes. Tiredness can come from poor sleep. Thirst can come from hot weather. Blurry vision can come from needing new glasses. This video is not a diagnosis, and it is not a replacement for medical advice. It is a guide to help you pay attention to your body, ask better questions, and know when it may be worth scheduling an appointment with your doctor. If you have symptoms that are persistent, getting worse, or simply do not feel right, please talk to a healthcare professional. And before we start the list, tell me in the comments where you are watching from and which symptom worries you the most. I read what you write, and your experiences often help other people who are watching feel less alone in what they are going through. Now let's begin. Number 1. Unusual and constant thirst that water does not seem to fix. This may seem harmless at first. You drink a glass of water and you feel fine for a few minutes, and then the dryness comes right back. Your mouth feels sticky, your lips feel rough. You wake up in the middle of the night reaching for the glass on your nightstand. You carry a water bottle with you everywhere, and it still does not feel like enough. Many people blame this on the weather, on talking too much, on the heater being too high, or on getting older. But when blood sugar levels rise above what the body can handle, the kidneys begin to work overtime trying to filter out the extra glucose. To do that, they pull water from your tissues, and that loss of fluid creates a deep, persistent thirst that ordinary drinking cannot truly satisfy. This is one of the earliest and most overlooked signs that your blood sugar may be too high. If your thirst has changed, if it has become constant, if it follows you through the day and into the night, that is something worth mentioning the next time you see your doctor. A simple blood test can give you answers, and early evaluation can help you avoid much bigger problems down the road. Number 2. Needing to urinate far more often than before, especially during the night. Many people over 50 assume that frequent trips to the bathroom are just part of aging. The bladder gets weaker. The prostate may be larger in men. The pelvic floor may be different in women. All of that can be true, but when high blood sugar is involved, the cause is different. The kidneys are trying to flush out the extra glucose in the bloodstream, and the only way they can do that is by pulling more water into the urine. The result is that you find yourself standing up to use the bathroom 2, 3, even 4 times a night. During the day, you may notice that you can barely sit through a movie or a long drive without needing to stop. Many people simply learn to live with this, rearranging their days around bathroom breaks and trying not to drink water in the evening. But this pattern can be one of the body's clearest signals that something is off. When it appears together with the thirst we talked about a moment ago, the combination becomes especially important. Catching it early can mean the difference between making small changes now and dealing with serious complications later. Number 3, a deep, constant tiredness that good sleep does not seem to repair. This is one of the most common complaints people bring to their doctors after the age of 50, and it is also one of the most misunderstood. You go to bed at a reasonable time. You sleep 7 or 8 hours. You wake up and you still feel as if you have not rested at all. By the middle of the afternoon, you feel as if someone has unplugged you. Many people blame this on stress, on grandchildren, on long work hours, on the weight of life. And sometimes those explanations are correct. But when blood sugar is too high, the body cannot move glucose into the cells properly. Glucose is fuel, and if your cells cannot use it, you feel exhausted no matter how much you sleep, how well you eat, or how much coffee you drink. This kind of fatigue is heavy. It feels different from normal tiredness. It is a tiredness that sits in your bones. If this sounds familiar, and if it has been going on for weeks or months, it is worth a simple conversation with a healthcare professional. There is no reason to spend years feeling drained when a basic blood test could point you in the right direction. Number 4, blurry vision that comes and goes throughout the day. You sit down to read the newspaper, and the letters seem softer than they should be. You drive home in the evening, and the road signs feel a little less sharp. The next morning, your vision is clear again. Most people assume they need new glasses, or that their eyes are simply changing with age. And while it is true that vision shifts as we get older, it should not flicker in and out like this. When blood sugar is high, fluid moves into the lens of the eye and changes its shape. That swelling causes vision to blur, and as sugar levels rise and fall throughout the day, your vision can shift along with them. People often live with this for a long time before they say anything, especially because it does not hurt. But blurry vision can be one of the earliest signs of trouble, and ignoring it can sometimes lead to longer-term issues with the eyes. If your sight has been changing in ways that feel inconsistent, please mention it to your doctor and consider an eye exam as well. Catching this early can protect the vision you depend on every single day. Number 5, unexpected hunger, even shortly after eating a full meal. You finish your breakfast. You feel satisfied for a little while. And then before lunch is even close, your stomach begins to growl as if you had not eaten at all. This is not the normal hunger of a long morning. This is a deeper, sharper hunger that does not seem to match the food you just had. Many people blame this on portion size, on the type of food they ate, or on a faster metabolism. But when blood sugar is high, the body has plenty of glucose floating around in the bloodstream. The problem is that without enough insulin response, that glucose cannot